These days, a buzzword, genetic testing, is all around, and so many questions surround the topic. So for our Women's Care Wednesday segment this week, we take a closer look at genetic testing with genetic counselor Devin Finley from Women's Care Florida. What's going on, Devin? Welcome back.
Thanks for having me back.
So it is genetic testing. I feel like it's one of those things that either people want to do it, they've thought about it, they've done it before. Explain why it's such a thing right now and people are trying to get their hands on it.
Yeah, it's a couple different reasons. I think a big part of it is just with social media, getting the word out there. People are hearing more about it.
Right.
Also, it's become a lot more affordable. So 10 years ago, it would have been thousands of dollars to do some of these tests. Now you can get them for $99 to $250 for some of these.
And you call it direct-to-consumer, DTC is the acronym that you use for these tests. There's good, there's bad. Let's kind of explore what people need to know maybe before they've done it or if they've done it.
Yeah, definitely. So two different types of genetic testing, direct-to-consumer, the kind where you're ordering a kit off of a website or off of Amazon even, and then you're getting a spit kit usually, sending it off, getting your results without going through a healthcare provider. Then you do clinical genetic testing, which is where you'd get that through someone like myself, a genetic counselor, or another healthcare provider. So with direct-to-consumer testing, the main thing to consider is it's going to be very different from what you get from a clinical test.
Okay.
So, one of the big pieces is ancestry. People are doing the ancestry, find out what their countries of origins are. And for the most part, that's pretty fun. You can find some unexpected information. But really the major concern is if you're trying to get health information from direct-to-consumer testing, you're not going to get the same information you get from doing a clinical test with your healthcare providers.
What are some of the answers to questions that you can get when it comes to doing it in the clinic with you?
So it depends on what the indication is. There's anywhere from cancer to cardiology to neurology genetics. I mainly work in cancer genetics and prenatal genetics with Women's Care Florida. So some of the major differences is, a lot of this surrounding breast cancer, the BRCA genes, which we've talked a little bit about. That's one of the major concerns. And a lot of people are trying to go through direct-to-consumer testing to find out if they carry that risk. Now, the challenge here is when you do direct-to-consumer testing, you're only looking at a very small portion of these genes that can be related to cancer risk. Whereas a clinical test, you're going to get all that information. So it's a much more accurate test, especially depending on your ethnic background. For example, there are some genetic testing direct-to-consumer where they're testing for the BRCA genes, but they're actually only testing for 3 Ashkenazi Jewish founder mutations. So if you're not Ashkenazi Jewish, the likelihood you have that specific change is very, very low. You actually need to get a clinical test with your healthcare provider.
Yeah, because then you find out that you don't have that, and then you might be thinking, oh, I'm good. I'm going to now slack off on some appointments that could be so key to your health.
Exactly. First of all, you could still have a BRCA or other gene mutation. Second of all, exactly correct. Even if it's negative, it unfortunately doesn't mean you could never get cancer. It doesn't mean you should stop your screens. So there's a lot of misinformation surrounding what your direct-to-consumer genetic testing results mean.
Well, it seems like a lot of people do the direct-to-consumer because of cost. We kind of addressed it up front that it's one of those cost-efficient ways to get some answers, maybe not all answers or correct ones as you want. What about cost for doing it through the clinical side of things?
So part of it depends on insurance, but if you meet criteria, so if you're coming in for a family history of certain cancers, if you're going in to see a cardiology genetic counselor because of a family history of cardiac defects, many insurances are covering it as long as it is appropriate testing for you, even if it's not. So let's say you're adopted or you don't know much about your family history and you say, I'm not going to meet insurance criteria, but I still want it.
Yeah.
There are tests as low as $250 for a lot of these cancer genes. So it needs to be ordered by a healthcare provider, but you can choose to pay out of pocket and get affordable testing.
So even if it's not necessarily recommended, you can still, you just have that want, that desire, that need to know, you still can come in and don't worry about the direct-to-consumer and work with a doctor on it.
Absolutely. Of course, there are, benefits and limitations to the testing, so you would want to discuss that all with your healthcare provider or genetic counselor. But if you understand the limitations of the test, you still want that information, definitely you can still get clinical testing.
I'm so glad we chatted about this today because I think it is something that people kind of wonder about. We've all thought about it, right? Well, thank you so much for your time.
Yeah, thanks so much for having me.
And as always, if you want more information on anything that we just discussed today, just visit Women's Care Florida. All that website is all on your screen right there.